It's not contracted. Okay, relaxed. It's relaxed. So it's relaxed. Okay. So you start with just the submental. All right. Submandibular. Okay. And you go all the way up to preauricular, preauricular, postauricular, and then the cervical lymph nodes. All right. Now, when you palpate for the cervical lymph nodes, remember, because you may be palpating the carotids, you don't do both in case you give your patient a bigger any pingsan. So you don't want to do that. Okay, so you just go down. That's cervical lymph nodes, supraclavicular. Infraclavicular. Right. Okay, back here. The left side now, cervical, supraclavicular. Okay, back here, occipital. And then you also have some here in the posterior triangle. You also have some lymph nodes. Right. Okay. Now, we had a discussion just now about why should you palpate for lymph nodes? Because really, actually, why do you palpate for lymph nodes? Enlargement, yes, but why?
Infection.
In what? Infection, that's right, and in malignancy. Okay, so in malignancy and infection. So infection, really, obviously, a lot of upper respiratory tract infections, and you get enlargement, cervical, some submandibular, depending, right, where it actually is. So I think that's very justifiable. But in malignancy, if you were to have lung carcinoma of the lung, where would the enlargement of the lymph nodes be? Cervical and
Mediastinum?
Yeah, actually. Mostly mediastinum lymph nodes. Okay? So then, so why are we looking for that? For which obviously we can't palpate. So then what are we looking for here, right? But if there will be some cases that it does drain into the axilla, not many, okay? Because mainly it is to the mediastinum. But are there any other conditions which can cause these lymph nodes to be enlarged? If you think about it, what are the kinds of malignancies? Lymphomas. So the actual primary malignancy of the lymph node. Okay, all right. So, so just so that you know that it is done, but the thing behind it is not very, just in case you say malignancy, you would be correct. But malignancy, if you're thinking about lung carcinoma, most of it drains into the mediastinum lymph nodes. All right. But certainly you would do it for upper respiratory tract infection here. Okay. Now, for the axillary lymph nodes. Okay. Now what you do is this. Okay, I'm just going to take your lymph nodes here. Alright, so you just rest your arm against me like this. Now you have the, remember when you palpate for lymph nodes, you're not just like palpating like, lymph node on its own, you always palpate it against a surface. Alright, so this would be the apical lymph nodes. Sorry, are you ticklish?
Yeah.
You're alright? Okay.
Yeah.
Okay, apical lymph nodes, okay, and then lateral, or you can have like apical or anterior, they also use, but lateral I think is always good. Lateral, easy to remember, and then medial, you generally just sort your arm. Okay, alright. Same thing here. So, apical. All right, so that's it. That's for your lymph nodes. One of the important things is always get them to flex the neck so that relaxes this, so it's easier to feel. All right, don't palpate the cervical both at the same time in case you give the patient the vagal. Know why you are palpating it and know the groups of the lymph nodes. Okay. Are you alright?
Yeah.
You managed to get all that even though you're the model.
Yeah.
All right. Any questions? No? Okay? All right. Get back to